The results of a new study revealing little to clear up the debate on how to treat the early stages of breast cancer. Let's bring in Dr. Ernest Patti, Senior Attending Physician of Emergency Medicine at St. Barnabas Hospital. Thank you so much for being here.
Thanks for having me, Molly.
This study is specific to something called DCIS. What is it, and how is it different from other types of breast cancer?
Well, DCIS is what they call ductal carcinoma in situ, and it's mainly cells, cancerous or precancerous cells that are found along the milk ducts in the breast. So, you don't necessarily feel a lump when you get this diagnosis. It's basically what they call either a precancerous lesion or stage 0 carcinoma. There's still a debate over whether it is carcinoma or not.
Yeah, and some 60,000 people diagnosed with this each year in the United States. This particular data was gathered over 20 years, 100,000 women. What is the window that it opens?
Well, basically what the studies did was, I think, actually give us some more information, but they actually seem to confuse us a little more. There's a couple things we have to remember, and that, not all invasive cancers, are going to be palpable or in lumps that you're going to feel. More surgery is not necessarily better for you, and that sometimes when you find areas of carcinoma in a body part like a breast or prostate or even in the cervix, sometimes leaving them alone, they actually regress and they disappear. So it mainly depends on the type of cancer and the area that we're talking about.
Yeah, the ultimate conclusion was the women had made choices, lumpectomies, or they had had mastectomies, and over 20 years, about the same amount of lifetime risk. That was the determination studying.
Right. You would think that they would have a better survival rate and less of them would have died from breast cancer. But in the end, when they looked at it, many of them still died from breast cancer that just never was picked up, in spite of the fact that they had the lumpectomies and the radiation or the mastectomies.
So what's the new information here that we have? And is this a dilemma that is opened up for doctors? Does it make it more likely they'll say, let's wait instead of pursuing aggressive treatment?
Well, what I think it does is it gives us the opportunity to really stop and take a deep breath. If you come out with this diagnosis, don't rush and get a radical mastectomy right away. You need to have a conversation with your physician. Many times I suggest people get a second or third opinion as well, just as an informational gathering thing, so that you can put all the information on the table and make an educated decision. What you need to do, though, is also limit or decrease your risk factors. Decrease your alcohol intake, don't smoke, eat a healthy diet, and have a healthier lifestyle, which will all decrease your chances of getting breast cancer in the long run. Obviously, you need to know your family history, and you also need to investigate that, and if it's high for breast cancer, then you need to go get further testing to see what markers you may have that are indicating that you might lean more towards getting a breast cancer diagnosis.
All right. Thank you so much, Dr. Ernest Patti, for your insight into this new study and something that's so close to so many hearts. We appreciate it.
Thank you very much for having me.